Our review article really focuses on the possible impact that hormonal contraception might have on breastfeeding. Both breastfeeding and contraception are undisputedly very important. Breastfeeding is recommended by the Center for Disease Control, the CDC, and the World Health Organization, the WHO, to be continued for at least 6 months in the postpartum period, and up to 2 years if possible. Contraception is also undisputably important and can help decrease the unintended pregnancy rate as well as rapid repeat pregnancy. To review the physiology of how lactogenesis occurs, the delivery of the placenta, which is the primary producer of progesterone, after that's delivered, you get a sharp decline in progesterone, which triggers lactogenesis stage 2. During pregnancy, you have high levels of estrogen and progesterone, which do inhibit lactation from occurring even though you have a high serum level of prolactin. There's also been a concern about possible steroid transfer from the hormonal contraceptive methods that have estrogen and or progesterone. So the steroids within hormonal contraception are transferred from the mother to her newborn via breast milk during lactation. And there's a theoretical risk to adverse outcomes for the neonatal brain, liver, and sex organs due to these exogenous steroids. While the amount of hormone transferred appears to be very small, there have also been very few studies examining the effect of these possible transferred hormones. However, the few studies that do exist have shown no or minimal impact. There are 2 wonderful resources for providers looking at hormonal contraception and lactation. One of them is the World Health Organization, the WHO medical eligibility criteria, and the other one is the United States medical eligibility criteria that's put out by the Center for Disease Control. It kind of comes in this nice pamphlet with a wonderful wheel that you can actually share with your patients. And it gives general categories of when different contraceptive methods should be started. The recommendations from the WHO and from the US MEC are very similar, however they vary in 2 areas. One is combined hormonal contraceptives and the other is for Depo-Provera or injectable progesterone. For Depo-Provera, the US MEC gives it a category 1 for both early and later initiation. However, the WHO MEC gives us a category 3 until about 6 weeks postpartum. For combined hormonal contraceptives, the US MEC gives us a category 1 for all women without contraindications after 42 days postpartum. This is in contrast to the WHO MEC, which gives it a category 3 until about 6 months postpartum. In general, the evidence has yielded mixed results on the impact of hormonal contraceptive during breastfeeding, but the majority of the data does support a minimal impact of progestin-only methods, and there's some less conclusive evidence when you consider combined estrogen and progesterone methods. There's also a question of timing and if we should start methods early or delayed. And starting methods early can also decrease unintended pregnancy rate and rapid repeat pregnancy at higher rates. In general, it hasn't been shown to have a profound impact on breastfeeding, but we do need additional data and additional research examining this area. There is a large unmet need for contraception in the postpartum period, and filling this need can decrease rapid repeat pregnancy and unintended pregnancy. Progestin-only methods of contraception likely have a very minimal impact on breastfeeding and can likely be initiated immediately. There is insufficient evidence of examining the possible effects of combined hormonal contraception and progestin-only contraception on breastfeeding, and we really do need additional research in this area. Women should be provided with additional lactation support in the postpartum period, and there's a large movement to creating more baby-friendly hospitals and increasing the lactation support, which can greatly increase the success of breastfeeding. Thank you so much for listening, and I do hope that you find our article very helpful.